Welcome to the Ring Collective. I am Angelica Leloai, and I am the CEO and founder of the Ring Collective. This space is for honest conversations about growth, the profession, and everything that shapes us along the way. Because here's the thing, becoming a clinician changes you. So let's talk about it. So I'm here with Patrick, and I'm super excited for this conversation because we are talking with someone who has a dual master's with athletic training, health informatics, and really dives into clinical education and in its importance with students. So thank you so much for being here.
Yeah, absolutely, Angelica. Thank you so much for the opportunity. And if I hadn't said it enough, like thank you for what you're doing in terms of just student engagement, student involvement, promotion of the profession. A lot of great things coming out of what you're doing with this podcast. And I implore you to just keep going with it because this is really fun. And again, thank you really for the opportunity to be part of it.
And thank you for saying that. I always get a little mushy gushy when people say stuff like that. And I'm like, you get it. You see the vision.
That's 1000%.
Yeah. Well, my icebreaker for us today is what's something about you that in your career you're known for something, but what about you is completely different outside of your role, but defines you perfectly?
Oh my goodness. This is a great question. Oh man. So I'm gonna get a little vulnerable here if that's okay.
Yes.
So a little bit about myself. I think just this is an experience that even though I don't remember it, I think is something that I carry very closely with me. So I was born severely premature to the point where my lungs were not fully developed. And at the time when I was born, I had to receive ECMO, which is extracorporeal membrane oxygenation. At the time, it was a very new technology. And, my family and I were very fortunate that there was a unit in San Diego over at Rady Children's where that's where I was taken care of for years. And I was part of case studies. It was such a new thing. But as I grew older, and obviously as an infant, it's not nothing that you really take you don't really think too much on it. But as I grew older, I began to appreciate a little bit more and more of how important medicine, technology, medical professionals, and really that how that really saved my life. Because the reality of it was, if we didn't have that technology and support, I probably wouldn't be here in front of you today. So I don't know that this 100% defines who I am, but I think just having lived through, even though I don't fully remember it because it was when I was super young, but having lived through a situation where I really might not be here today, it is something that I carry with me because it helps me stay grounded and just be really appreciative for life and the ability to live. And I think that's where I carry that into my work and wanting to just be a really positive impact for other people, whoever I come into contact with, just being a really positive influence on people because you take life for granted sometimes. And I think that's kind of like the lesson that I'm carrying with me for the rest of my life from that. So I don't know if that fully answers your question, but that's what comes to
Yeah.
mind first.
Well, thank you for feeling like you could tell that story here, and I think it speaks true to your character. You were born into something needing medical help, and then you're joining the medical field, and you're doing it in a way too that is so it's streamlined right now, specifically with health IT as well on what you're doing that you've already implemented yourself within the system, and it's creating something really great going forward. So I think that's really cool to see, and it's almost it is an inspiration because you see things like that where it's just stories that
Mhm.
when you see someone you would have never known
Right.
unless you asked.
Yeah, and I appreciate you sharing that. That truly that means a lot to me. And
Mhm,
again, my hope is that I just continue to find ways to be better. I'm not perfect. I will never say that I am perfect, nor will I ever be perfect. But it's just again that level of appreciation for life and the ability to help other people. And
mhm.
so no, I appreciate that, Angelica.
I wanted to get into your childhood a little bit
Sure.
more. So, of what you do remember on this round, what would you say your traits were that maybe contributed to this background of wanting to help others?
Oh, great question. And what's interesting is actually, I was a kid. I was actually pretty shy. You'd probably think I was an introvert as a kid, you know. And part of that was my dad served in the military 20 years, went overseas with the Navy. So I grew up primarily with my mom and relatives that were helping us out for a portion of my childhood. And so a lot of time was spent at home. And so it took me a little bit to kind of break out of my shell. Really, actually more than a little bit. Probably wasn't until high school at some point where I actually wanted to start being a little bit more extroverted. But so a lot of it was honestly, and I think this is why I connect myself to high school. A lot of it was becoming comfortable with being uncomfortable. I think as a child, I was, you know, I got too comfortable being sheltered, being comfortable in this bubble routine, whatever you want to call it. And once I started putting myself out there in high school, started joining track team, cross country team, meeting other people, that's what really forced me to get out of my shell, really. And that's, I think, just that evolved into something more in college where I became more involved with student organizations, whether it was professional, cultural based student organizations. And then from there, it brought more opportunities to lead different projects, plan events for the university, things like that. Which is kind of what brought me to why I love what I do today, and working with people, right? And setting up people for success, and having that outlook.
And how did you get into athletic training? How did that come about?
That's a great question. So a little bit vulnerable again. So I am Filipino American. There's kind of a little bit of a stigma within the Filipino American community that a lot of kids, especially first generation born USA Filipino Americans, are encouraged to go to nursing. Right, that's kind of the thing. Now that I'm older, I understand why. I think a lot of our parents who, you know, again, my family immigrated via the US Navy. And I think at the time our parents were thinking about, you know, what's going to set up my children for success. And they saw a lot of success and stability in nursing. And it is a great career. And I'll tell you that I have the utmost respect for nurses because they're a huge part of patient outcomes and carrying, you know, plan of care and everything. But how I got into healthcare started with that. Where my parents were like, "Hey, you got to check out nursing. You got to do this thing. It's a great job, great career." Was it what I wanted in the beginning? Probably not, but I was like, you know what, they're my parents, I got to give this a shot, right? So I started doing some volunteer hours at a hospital, and quickly, I mean quickly, found out that it really wasn't the setting for me. I mean quickly. I just remember, I mean, the hardest thing that I had, the hardest factor that I had a hard time grasping with the inpatient hospital setting was the level of vulnerability that patients are in that state, and the very reality that there are some cases where you get to know your patient, you know, you build a great relationship, and the next day they may not be there anymore. And I kind of
Wow.
tie that back to, again, my personal experience with myself as an infant, and having to shoulder the emotions behind that was a little bit hard for me. Again, this is part of why I have so much respect for nursing in the medical community, the inpatient setting. It's a lot of emotional burden to carry. And it was
Uh-huh.
just something that I wasn't ready for, nor did I feel like I could bring my best self forward having to shoulder that much emotion. Now, from there, I was like, okay, nursing's not for me, right? This ain't it. What did I know? I knew that I loved I took human anatomy and physiology in high school, and I fell in love with it immediately. And so I was like, okay, what do I want to do? Do I want to be a doctor? Do I want to go into PT, OT? One of my best friends talked to me about athletic training. He goes, you know, Patrick, you ran track in high school. You're doing sports. You know, you should check out athletic training. So I did. Same kind of thing. I did some internships at some local schools and colleges to just get my feet wet on what it was about, and I had a lot of fun with it. And I was like, this feels right. And so then I went down the athletic training path, and then it was all history from there. So
And how did you incorporate that student clinical education and leadership with athletic training?
and this all starts from when I was an athletic training student. I know that curriculums have truly evolved since I was in school. I was in athletic training undergrad in 2011 to 2013. Was the years I was in the program at San Diego State. But at the time, I was full-time student taking classes, and we were doing full-time hours. I'm talking like 30, 40, sometimes plus 40 hours a week. So I totally like that's why I also feel for clinical students, because I get it. Like it's a really busy schedule. So it starts back then where, you know, I'm full-time student doing full-time clinicals. I get involved in our professional pre-athletic training program. So again, that brought me some opportunities to be part of the executive board and kind of leading that organization. So within that, I had an opportunity to help plan a couple of events, manage finances for the professional organization, and then from there, I once I graduated and I got my certifications, I've been certified for 13 years now. It's crazy to say. Immediately, I was like, I want to be a CI, right? And my drive to becoming a CI truly comes from the way my CIs treated me. And so immediately as a student, and being given the guidance from my own CIs, I was like, I want to do this too. I want to give back to the profession. I think this is a great way that I can continue contributing to the growth of the profession or just in healthcare in general. And so then, I became a CI. I was pursuing my first master's degree out at West Virginia, became a CI, had a couple students. And then I was working in outpatient orthopedics and I was also doing a little bit of collegiate sports as well. So a little bit of a mixed setting scenario, but that's where I first got my exposure to being a CI, and actually it was a lot of fun, but it was also a big learning experience. So again, kind of thinking about my first years being a clinical instructor, I carry that with me in how we prepare and train our own clinical instructors who are making that leap from being a licensed clinician to being responsible for your own students, because it is kind of scary, right? Because as a CI who truly cares about their students, in your mind, you're always like, I want to do right by my students. I want to do whatever I can to set them up to be successful, to be even better than what I was as a student or even as a clinician today. That's kind of been my mindset as a clinical instructor. And so that was a big growing point for me when I was doing my master's. So my first 2 years getting my master's degree, I had a big just learning curve about what it means to be a CI and how to balance that in managing my patients, making sure that my patients are still having really good outcomes, but also that my students are having really good learning outcomes, and making sure that I'm addressing, what they want. Again, with that end goal of trying to do my best so that my students can hopefully be better than me as a clinician. That's my goal. I want my students to be better than I ever could be, And so that's what my first 2 years of being a CI was like, was really trying to pen that out. Then when after my time at West Virginia, I ended up getting hired at the University of San Diego. So I worked in Division 1 athletics, and 1000% still wanted to be a CI. So I worked with a couple different schools and universities and continued being a CI. But my shift then came from, okay, I feel confident about what I'm doing with my students. Let me flip my perspective a little bit and think about how my students are feeling. So now instead of asking myself the questions internally, how am I doing? Let me now turn my attention to my students. How are you doing? What are you looking for? How can I help you? Because in the beginning, I think this is a commonality that a lot of new CIs have, is a lot of us like to revert back to, okay, this is how I was trained as a student, so I'm going to lean on this. This is what worked for me. And there's a lot of assumption going on, right? And it's not a bad thing, but I think it's a lot of just like I had comfort in how my CI taught me these manual skills or how to carry out this evaluation. And that's kind of what I leaned on in the beginning because that felt comfortable for me. Then as I gained more experience, I flipped it to put the attention on the student and be like, what works for you? What are you looking for? How do you like to learn? Are you more kinesthetic? Are you more visual? Do you want me to demonstrate something before I give you the patient opportunity for it? So I began to look a little bit more outward towards my students and allow them to drive their experience and just kind of being there to support what they wanted out of it. And so having gone through that journey played a big role in how I look at clinical education today from both a student perspective and also a CI perspective. Because I think there's a continuum we have to think about, that it's not just one or the other. That in order for maximal learning outcomes to be accomplished, you need to have a good experience for the student and the CI, and making sure that there's good communication, that both parties are on the same page, and then they're both in it, to achieve the same goals, which is just better outcomes for patients, for students. That's a long-winded response, but I think that hopefully gives you an idea of how my personal experiences led to how I view clinical education for students today.
And I think it also gives students some clarity on what is happening on the other side, because a
Mhm.
lot of the times when we go into clinicals, we're just nervous. We have no idea what's going on. We don't know where we're going. We don't know who we're meeting. all we get is a name and an address and the name of the company, and that's about it.
Right.
And so there's a lot of things, going on in the student's head. And I think knowing that we are being cared for and there is good intention with it, I think gives a lot more, just peace of mind.
Mhm.
And a big thing that you had stated that really gravitates towards me is that you mentioned that the best learning that you've seen as being a CI or student receiving help or mentorship is that you also realize that every student is different. Every
Mhm.
student takes things differently. Every student receives information differently. And like you said, sometimes maybe they need to feel what you're doing to see what it is. They need to know what a positive Lockman's feels like.
Yep.
They need to know all these different things. Or maybe for me, like I'm auditory. If you speak it out loud, I'll remember it. But if you show me a picture, I'm not gonna remember it.
Yeah.
Like, it's one of those where it's just everyone's very different, and I
Mhm.
think when your CI is comfortable to be uncomfortable, to get out of what made them comfortable and knows that this will work for you,
Mhm.
then that's the formula for success because the student's already uncomfortable. Like,
Right.
they showed
Right.
up, like, that was the step.
Yeah, yeah, 1,000%, and that's one thing that I've truly enjoyed about, my role at PRN. One of the cool things we just did this year, we actually just launched a brand new CI training program, and in one of the modules that we have is we do talk a little bit about different learning styles. So taking the time to educate our educators about how do students learn? What are some
Mhm,
different styles of learning? What are some different mentorship styles, right? Different styles of providing feedback and receiving, because that's even another thing too. Understanding with your students, how do you like to receive just asking the question. And that's kind of like one of the statements I make in our training program is if you get anything out of this, right? Is at the bare minimum, talk to your students and ask the question. How do you like to learn? How do you like to receive feedback? Because like you said, Angelica, every person is different, just like with our patients, every patient is different. Every ACL is can be treated differently. Not one protocol is going to work for every single condition for every single patient. So I think it's
mhm,
honoring the diversity in different learning styles, mentorship styles, being open to being flexible to that. And I think as a
mhm,
CI, being uncomfortable to stress yourself, even though maybe you're a kinesthetic learner, but challenging yourself to be a little bit more flexible to an auditory learner. So it's really
mhm.
on the CI preparation side. It's about making sure our CIs have the tools and the base knowledge to at least be open, and asking the questions and just talking with their students.
I will say I have an experience almost similar to this. When I was in college, I played indoor and beach volleyball,
Nice.
and my coach, he gave me the opportunity to be a coach at a volleyball club. And I was like,
Nice.
"Okay, like I don't know what this is, but I'm going to try." So when I first went in, I coached the way that I was coached. But my coaches were a little hard. Like it wasn't that's what I knew. And one of the things that the club really strived on was coaching coaches. And
Hmm.
so I would go into these meetings and go into these things of like, oh, I didn't realize you could approach it this way. This is all I knew. And yeah, I didn't knock myself for not knowing.
Hmm.
It was just I didn't have the opportunity to see something else because I was the one receiving it. Like this
Yep.
is all that I got. And it got to a point when I was coaching that I did the visuals, I did the auditory, I did the I'll show you, you show me. Like
Yeah.
I did the delayed camera where they can do it, they run back, they see it, they go back into the line, do their
Yep.
approach again. So incorporated everything that they showed me, and it took a lot of prep work in the background. Like you said, I had to be okay with being uncomfortable with what I'm used
Yep.
to implement something like that. And at the time, like our team, we went from losing like every game, like we were losing all our games to all of a sudden it was like win, 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 win.
Nice.
It's like a great thing because it's like it's not a coaching thing, it's a coach and player thing. Like
Thousand
we're
percent.
understanding each other, and that's what I hope people get from now bringing it back to for me for physical therapy,
Yep.
having that connection with your CI because at the end of the day, the patient's still gonna come in. You want a good out you want them to leave happy and not upset and say,
Mhm.
I only wanna see the therapist, not the student."
Yep.
Like that no one wants to hear that.
No, no, of course not. And it like you said, it's alliance, right? So it's like patient provider alliance. It's like aligning as a
Ugh,
CI, aligning with your students, right? Because at the end of the day, the patients are going to be receiving care from the students as well. So we want
yeah.
everyone to win. We need everybody on the same page, working together, leaning on each other, asking
Mhm.
questions, communicating. So kudos to you. Way to get your team out to some wins. That's awesome.
Well, it was so funny because we had a really big game that was gonna get us into, like, the big 1st and 2nd place game,
Yeah.
but we had to beat the 1st seed of my club of the same age group. And we were the last like, we were the 4s, they were the 1s,
Yep.
and at the time, the 1s was like, "Oh, we're gonna beat them easy," and I was like, "You know what, boys? Like, we're gonna watch every time we have an off game, we're gonna watch their games." I taught everyone to stat the way that I learned,
Yep.
and so I'm like, "You stat your position and you come to me and we'll see if we saw the same thing," and so we did that for a couple days. So when the game came, the one's team was like, "What the heck just happened?" We lost by 2 on the 3rd set. I ended the game really happy, like, the boys were like, "Ah, we lost," and I was like, "You did amazing, like, that is
Yeah.
the best I've ever seen any of you play." Well, I wanted to hit into your now the other part of your master's,
Sure.
going into the health informatics.
Yep.
So for our listeners who don't know what that is, could you sum it up and give an insight of how that plays into the profession today?
Yeah, great question. If I could sum up healthcare informatics, I would say it's any type of tool. It's the philosophy, the ideology behind taking any type of tool, any type of technology, any type of resource and applying it to the medical setting in order to improve the patient and the provider experience. So it's kind
Mhm.
of broad, but that's really what it's about.
And if those are still wondering, a very easy example is AI.
Oh my
You'll
goodness.
hear you'll hear that all the time with your doctors. "Are you okay if AI is on
Yes.
for this session?" That's a big one.
Yeah, 1,000%. And AI is it's transforming healthcare and you know at PRN specifically we have it fully rolled out now and we're seeing a lot of really great outcomes and I think there's a lot of questions right now. And AI is such a hot topic. I think a lot of it comes down to how an organization chooses to leverage AI in that patient provider experience. You know, I think at PRN what we're seeing is that it's improving the providers experience because it's minimizing documentation time, it's helping formulate documentation. It's not replacing the clinician because the clinician always has final say on the documentation, but it is minimizing that administrative time for the and then what it's also doing is it's taking the computer out of the equation. It's not all the way there yet, but that's what we're seeing is that instead of
Mhm.
having a computer in between the patient and the provider, we're now moving it to the side. Let me talk to my patient eye to eye and make this a true, genuine interaction, right? Instead of like, how was your day today? Are you compliant with your home exercise program? Okay, let me type that in. Okay, what's your pain rating on a scale of 1 to 5 today? Oh, it's a 4. Okay, let me type that in. Okay, I'm gonna do a palpation. Does it hurt here? Okay, let me type that in. So you get what I'm saying. So it's
Yes.
removing all of that repetitiveness. It's removing the physical object of having a computer between the patient and the provider. But what we're seeing it do is it's encouraging our therapists, our clinicians to be much more descriptive about what they're doing in front of the patient because that's how the AI is picking up how the visit is going or what's being done at the visit, right? So instead of poking and prodding and being like, you know, oh, does this hurt here? And they say, patient says yes. Okay, let me go document it. Now it's like, hey, I'm palpating the tibial tuberosity. Can you let me know if this is tender or not? Right? So that does a couple things. Number one, the AI hears it. They can document that into the note. The patient hears it, And now they feel like they're more part of the visit. They're getting more patient education out of it because they're hearing the medical terminology. And I know a lot of times we want to be careful about how much medical jargon we're using in front of patients. But in a lot of cases, it's good for them to hear it too, because I think it also builds a lot of credibility with a therapist. So it really helps that, again, that patient provider alliance. It helps build that credibility. Oh, I can, as a patient, now it's like I can hear what's going on. I know exactly what my provider is doing with me, and they feel more part of the visit, and there's not that interruption of like, okay, let me type this in really quick and then let me get back to you, right? So
Uh-huh.
we're seeing a lot of great outcomes in terms of patient satisfaction, in terms of provider satisfaction, and minimizing administrative time. And really, as an organ, just speaking on PRN's behalf, what we're trying to do is just really improve that experience for the patient and the provider. And every
Uh-huh.
organization is different. I think that's what remains to be seen as we continue moving forward with how AI is getting integrated into different parts of our lives. It comes down to the organization, and that's what we've seen so far at PRN.
Yeah, and I think that's huge because a big portion of comments that come from patients is whether or not you make eye contact,
Yeah.
whether or not, like, how long are you actually talking to me? Like, it's all about that patient experience. And we've had webinars and, big, big functions for PTs that specifically teach PTs how to treat patients better, how to be more humanistic, which is a sad thing to say, but it's come to a point, like you said, where documenting is so big, especially if you run with insurances,
Hmm.
keeping within those guidelines of what the insurance contracts say, it can get a little bit difficult to still be present for the patient, still be within the guidelines of the insurance, keeping
Hmm.
everything legal and truly to what you did,
Yep.
and also still not feel burned out. Like, there's a lot of things to juggle in that, and I think that's huge. And I will say I actually learned this from you because for those that don't know, we met during CSM.
Yep.
And it was actually very scary for me because everyone was like, "You need to talk to this guy." And I said, "What guy?" And like everyone's like, "No, no, no, no. I'm going to take you to him. You're going to talk to him." And I said, "I'm scared. Like I don't know who I'm talking to." And I came up to you. And one of the things you were talking about was about that communication with the patient,
Hmm.
and sometimes that medical jargon isn't a bad thing. And I will say since then, as a PT aide, I have been incorporating something like that so that I'm a little more used to it going into the field. And
Hmm.
I noticed that even if they have no idea that I just told them the fibular head is right here, and sometimes a nerve can get entrapped there, and that's
Hmm.
why you feel that pain. Now they know, okay, so it's not just this, like it could be this. Or I'm telling someone, oh, they tell me their imaging said that they have OA. And I said,
Hmm.
"Well, they're like, and it's so bad. I have OA. I can't do this." And I said, "Well, do you want to know what it is?" And they're like, "Well, what is it? I already know that it's bad." And I said, "Well, it's actually really common as you age. So I don't want you to feel like it's so negative." And
Hmm.
something like that opened a whole new conversation. And
Yeah.
I think that's what I've noticed with people who do use AI is that you start with something, again, uncomfortable and new.
Hmm.
And if the patient bites, you have the opportunity to include them in the care. If
Yep.
the patient doesn't bite, you have the documentation and you could change the word if they don't get it. Be
Yep.
like, their ischial tube is hurting. And
Yep.
then they'll be like, "What is that?" And I'm like, "Your sit bone." And
Yep.
they'll be like, "Okay."
Yep.
It's something like that where I think I feel like it's just raising the standard of care, raising the standard of
Yeah.
communication, and in the long run, there's nothing wrong with that.
No, and I agree with you wholly, especially in this day and age. I think a good thing is that people are becoming more curious about what's going on with their body, what's actually being
Mhm.
said at my medical visits, whether that's with my MD, with my PT, with my OT. What's going
Uh-huh.
on? Because I mean, I go see my doctor. My natural reaction is to take the notes and go to my computer and do some googling, right? So why not just be there for the patient from the beginning? This is what's going on. You want to Google it
Yes.
up? Go for it. Let's do it. So.
Yes, and I'm so big on people owning their degree. Like, you are a doctor of
Mhm.
physical therapy.
Yep.
You learned everything you needed to know to be a movement expert. Own it. Like, let them know because you don't there's always this, like, this thing of, like, we get confused for personal trainers, and I'm like,
Oh
yes,
my, yeah.
they do something amazing as a personal trainer, but also there's a lot of things that we look in the background, with all the systems, and
Yeah,
it's one of those where really, really give credit to yourself and the schooling you put yourself through because you know your stuff, you took your test, like, you like, you did your due diligence to get where you are today.
absolutely. Absolutely. Couldn't have said it better.
Yeah. Yeah. Well, where do you see this going in 5 to 10 years from now? Not just AI, but
Mhm.
everything in general of, like, the health IT realm.
Yeah, that's a great I know all these are great questions, my gosh. Um, where do I see things going? Again, a lot of this is gonna be organization dependent, and I think I think you hit the nail on the head. You made a comment earlier about how all of this is really just to help drive quality of care, right? Because that's why we have different policies, different standards in place, is to make sure that as we're growing and advancing, as a community, as a medical community, that what we're putting out is still deemed as quality care. And so I think that's what's going to really drive a lot of the direction in how
Uh-huh.
organizations leverage AI and other technologies that might come out, diagnostic imaging in clinics or whatever it might be. A lot of it is going to be tied down to quality of care, and not just quality of care in terms of as a general statement, but in terms of, is the patient receiving the right type of care at the right time by the right provider that's proven to give the best outcomes, right? Because a lot of what we do is evidence based, or we say evidence based practice all the time. I think as time goes on, that evidence is going to continue playing a bigger factor in how care is delivered, right, in the medical
Mhm.
space. My personal opinion on it.
And I agree with you. Like, it's everything is changing in terms of, like, how you treat Parkinson's and how you there's all these things of, like, how
Oh my
hard can you push
gosh.
an MS patient?
Oh,
There's a lot of new things coming.
it's amazing, right? Because I even think about like concussions and how we treat post concussion before back then. You got a concussion,
Mhm.
dark room, can't go, don't go see anybody. Don't step out of your room. Stay in a dark room. You can't do anything. Now the approach is a little bit more active. Like we should get into ADLs a little bit more sooner than before. Starting to integrate more ADLs, return to classroom is a little bit earlier, return to sport is there's a more graded progression for it. It's amazing how care and protocols are changing and evolving, and it's all tied down to the evidence, right? I think concussion being an example, post concussion being an example, I think that the evidence was showing that putting somebody in a dark room for like 11 days was actually more detrimental than it was helpful, because it was shutting down muscular activity, neurovascular activity, things like that. And so
Mhm.
yeah, evidence is going to continue to drive what we do.
I wanted to go a little bit more now into, the student side of
Yeah.
things.
Oh yeah.
What do you think most students misunderstand about how clinical placements actually work?
Well, in the placement process, it is different. It's different for every program. It's different for every clinical partner. So, as a student, my word of advice is work very closely. First off, understand what your placement process looks like. Your school is going to explain that to you. And then you want to work very closely with your DCE, or if you have multiple DCEs, one of them or whoever your assigned one is going to be. Work very closely with your DCE. I think what's important for you as a student is kind of understanding what's your end goal today, right? And your end goal can always change. I think sometimes, in working with students for a couple years, there are often times where students will try and pigeonhole themselves into being like, okay, before I elect my rotations, I have to know that I want to go into an inpatient setting or out, or that I want to specialize in neuro, or that I want to specialize in sports. It doesn't have to be that way. But what I would encourage is kind of have a good idea of what you want your end goal to be. And that could be just with, the first 2 to 5 years post grad. What do you want that life to look like? And maybe it's just something that piques your interest. Maybe you're a little bit, you're a little bit more towards the outpatient or athletic population, or maybe you are more towards geriatric. Wherever you're at, I think start there and think about what your placements are going to look like and how it lines you up to prepare you to be involved into whatever specialty or interest area you have in. Then
Mhm.
what I would do is I would take that, compare it to what your placement process and what your curriculum looks like. And then from there, have an understanding of, okay, if my goal is to end up in a sports specialty, right? And I know that in my curriculum, specialty rotations don't happen until the very end, which could be my third, fourth, or fifth rotation. What do I want to do, or what do I want my path to look like leading up to that sports rotation if I can get it, right? So kind of formulate and work together with your DCE so that they know how to support you, because they want to support you. Everyone in clinical education, on the academic side, on the clinical partner side, we all want students to succeed. And so I think it's really important that you let your DCEs know kind of what you're thinking about. Lean on them for advice, because your DCEs will know all of the clinical partners associated with your program. And if your DCEs have an idea of what your end goal is, what your thought process is, they can give you some really great advice about, like, we can start you an outpatient rotation one, get you into an acute care rotation two, then you can jump back into an outpatient sports specific rotation for number three or whatever it might be. But
Mhm.
what I would encourage students to do is just start to think about it. Think about it early on. Like, as you're learning, if you're still working as an aide or if you're still doing some volunteer hours, think about what you want your end goal to be post grad. And then think about what your curriculum looks like, how many placements you get when that happens, and then align with your DCE. Communicate, work well with your DCEs, because that's where the placements happen. It's not through
Mhm.
us as clinical partners, right? It's through the DCE. Yeah.
And I think that's so important because a lot of the times when we go in, they do have us make goals, but they are short focused. They're the term you have the goals of what you want in the time frame of your clinical. But I
Mhm.
think it is really important to think ahead. And even if you don't know the end game of the specialty,
Yep.
you will have a goal of what you want to be like as a
Mhm.
clinician. So that at least can give some people some peace of mind of like, maybe I have no idea what to do, but like you said, you're gonna know what you want out
Mhm.
of it. Like, you're gonna know, like, what kind of or maybe, like, when you go into your clinicals, you can revise it. Like, it's not the know all be all
Oh, yeah. Oh,
goal.
yeah. Absolutely.
Yeah.
And even as you're going through clinicals, you may get to a point where maybe you started off creating a plan that says, I need something that's going to create a pathway for me to get into geriatrics, right? Geriatric specialty. But maybe along the way, you get into a clinical rotation, whether maybe it's outpatient, maybe it's, skilled nursing facility or an acute care unit. And you're like, oh my gosh, I have fallen in love with this. You can always
Mhm,
pivot. You can always pivot. I think it's just great to have a good starting point so that you can kind of formulate something so that if it does work out that way, you've kind of set yourself up well. But also knowing that as you're going through rotations, if things change, if you develop a passion for something else, you're like, no, I love orthopedics. I want to be a specialist in this area. You can always do that. It's all good.
mhm.
Yeah.
That's one of the things I really bring up a lot on the podcast is one of the things I say is that it's like a freeway. You can change lanes wherever you want, wherever you see fit. You could
Mhm.
be a peds PT for the first 5 years and then switch to neuro and then
Yep.
do that for I don't know 10 years and then switch to something else and work with military. The umbrella for PT is so big and
Yeah.
I like if there's one take home message from that it's just like the PT world is so big, you don't have to put yourself in a box. Like, you
1,000%. Yes, and that's one of the best things about the profession is that your scope of practice is so
Mhm.
wide, and you know, it's exactly as I wouldn't say it any different. You said it perfectly. So I agree with you. I agree.
Thank you. Well, I have somewhat of a hot topic, and
Sure.
I don't know if you'll have the answer yet to it, but
Sure.
as you may know, curriculums basically across I would say across the US in general, if I'm just speaking there, the curriculum for PT is shortening. That
Mhm.
is the big thing. It's less school time, and at times the positives is you're in and out of school really quickly, so you're not giving too much of your life, but the downfall is it's a even bigger hose of information going down.
Yep.
And in your opinion, do you think that the PT education is evolving in the right direction? And when I say that is like, are you noticing that there are differences in how prepared students are coming out into the clinicals, or is it too soon to tell, or you haven't had any problems?
Great. These are, I say it after every single question you ask. These are great questions. My personal opinion, I think it is a little bit too soon to tell. Okay. Now, what I will say is that I totally understand what you're saying. I can see that happening too. I think what's important for students or prospective students is doing a lot of research and finding the program that aligns to how you want to learn and how you want to emerge into the
Mhm.
profession. Because there are a lot of students who are very successful in, say, a hybrid format that's a little bit accelerated. There are some students who need to be on campus full time and need that face time, need the more hands on. And so, again, going back to what we talked about earlier, everyone's got a different learning style and everyone's
Mhm.
got different time commitments around school, right? So, I mean, there are some people who are working and doing extracurriculars, right, on top of being a full time PT student. There are some people who are just dedicating 100% of their time to school. So, I think a lot of it today and what we can do today, and what I would implore students to do, is do a lot of research as you're looking at schools to apply to. Find the ones that align to how you like to learn, what you want your life to look like, not only during the program, but during your clinicals and what
Mhm.
you're and how that's going to set you up for your career, right? So even going down into looking at curriculum, when do the placements happen? Is it all after didactic? Is there one that happens before all didactic is complete? How many rotations are there? How long is each rotation, right? So every program is special in their own way and they all offer something different to the student. I think it's all about finding what matches to what you like and how you like to learn. I think that's the important piece
Mhm.
today, you know?
Yeah, and I do agree. And that kind of goes into my next question as well, because a lot of the time students, we, and I'm one of them, I still am scared of this to this day, but it's going into a clinic and just being, another clinician that's going to bring up productivity for the clinic.
Mhm.
And that's like the scariest thought is to go in and you're just bombarded with 20 patients and it's your first time seeing. And, it does come to that like, yes, communicate with your CI and communicate those things before. My question to kind of pivot away from that, knowing I think that's the answer you're gonna say,
Yeah.
but but now going from that, what would you say makes a clinical site truly great for the student versus just available?
Oh, that man. I was going to say it again. Great question. So, this is where, again, I'm going to start off by saying be very close to your DCEs because your DCEs are going to know your clinical partners very, very well, right? Because
Mhm.
they're placing at these sites, they go out on site visits, they're doing midpoint and interim check ins with the CIs, with the students. So they have a pretty good feel about what's going on and what that clinical site is about. Um, my opinion, right, on what makes a clinical site good, I think it comes down to we can get into I can nerd out about this all day. But I think what it comes down to is does the site show that they care? Is what it comes
Mhm.
down to. Is everything that they're doing around and for the student and for the CI, because it's two, remember we talked about this, student and CI, show that they care, right? So fortunately, my experience at PRN, I think we recognize that as a larger organization, that means we also have a larger responsibility in terms of how we prepare the future of the profession. Having a geographical footprint like we do, we can't just sit back and just sit here and be like, okay, we're going to take students and they're going to get see some patients and whatever. There's a lot more to it. And I think what I loved about working at PRN is we've shouldered that responsibility and we said, yes, we recognize that we have a bigger role to play. We're willing to put more resources into this to make sure that students and future clinicians really have the tools and the support they need so that they can have a valuable experience with us. Because
Mhm.
the way that I look at it, my personal perspective, when I look at our patients coming through our organization, I think about what I picture in my mind is like these students, one of them could be treating me one day as I get older. So I better do a dang good job making sure that
Exactly.
they're learning and having a good experience because they could be taking care of me or my parents or somebody. So that's one of the perspectives I carry into it. Just showing that there is intention and care behind how they're treating students, right? So I think it's a pretty easy statement to make when I say that as CIs, we all can think back to day one of clinicals, the nerves, the like, what do I need to wear? What's my schedule going to be? Do I need to wear a badge? Can I wear tennis shoes or do I have to wear business formal shoes? Where do I park? Oh my gosh, is there a permit? Like, new clinic, maybe you're in a new city you've never been. I mean, you've just traveled overnight to relocate so you can start clinical on a Monday, so you're exhausted. You've got the nerves because you don't know anybody in this clinic. You're seeing equipment you've never seen before. Patients are looking at you like you're the new person in the building, right? So as CIs, I think, we understand that because we think back to when we were students. And so when I think about how we train our own CIs, I always ask our CIs to remember that day. Remember when you were a student. Put yourself in the student's shoes. Remember what that first day
Mhm.
felt like. And I think one of the earliest things that you can determine being a student at a clinical site is within that first week, within the first couple days, the site should be able to establish, number one, that this is a safe place for you, right? It's hard to want to learn if you don't feel like you're safe. So that the clinical site feels safe for students and that it's a positive clinic culture, right? Because I think without those two pieces in place, as a student, it's hard to learn, right? I think part of learning is having not only having the confidence, but feeling like you have the ability to put yourself out there, test your skills, take some risks, contribute your ideas to what the team is doing with patients, introduce new exercises. But you can't do
Mhm.
that if you don't feel safe where you're at, right? So
Mhm.
I think it all starts there, establishing a culture and a climate of safety and positivity that you've got the support of the entire clinic, not just your CI. And then from there, what else is the organization supporting you in terms of how you're being progressed and transitioned into the clinic? And what I mean
Mhm.
by that is your example earlier of like, am I going to be thrown in and I'm going to have a full caseload on day one? Yeah, that's not a good learning experience, right? I haven't even put my backpack down and I already got a full schedule. I'm like what? you know?
Yeah. You have
So
no prep time.
no, yes. So it's understanding, and this is where again your DCEs are going to know the clinical partners very well, based on previous experience, based on being on site. So at PRN, we train our CIs to be very cognizant of not doing that with our students, right? Being very intentional about let's make sure that the student feels comfortable. Number one, day one, start meeting other patients, meeting other clinicians, get comfortable with the space, and then over time,
Mhm.
right, kind of progressing according to what the goals for the rotation are, right? And I think that's another distinction to make is that there are productivity goals for the organization, for licensed clinicians, and then there's goals for the student and that rotation. And I think that clinical sites should be able to differentiate the two because a student clinician is not the same as a licensed clinician. So I think
Mhm.
how you're being progressed should be tailored to your goals for the rotation. So that's another piece that I would throw in there too.
And I think that really speaks something to me because I will say, like, when I was an aide at a different company, there was a time and place where we had 3 therapists with 3 students and a PTA with a PTA student.
Mm,
So, automatically, we went from 4 clinicians to 8.
mm,
And if anyone has ever maybe they can relate to this, if you've been an aide and you're working under the supervision of someone who's licensed and now it's doubled, like, that's insane. And so being put in those situations where it is your job and you kinda have to do it,
mm,
that was one of the things that scared me. I'm like, "Okay, well, when I go in," like, yes, I've worked as an aide, I've worked with a ton of patients all at once, but I don't wanna feel that anxiety going into a clinical rotation.
yeah.
Like, I wanna feel how you said I can get into the zone, I can get into that space where I can try something new or I can learn something new, and I think that's really important, and I feel like it gives peace of mind to me and maybe to those listening of, "You know what? Clinicals aren't that scary." Like, if you just talk, it won't be that scary, and even if, like you said, if it doesn't mesh, you have someone to talk to either put you somewhere else if it has to get to that
Yeah.
point, or help bridge that communication so that you do get what you're ultimately paying for this experience. Like, you're gonna get what you paid for.
Absolutely, absolutely, and I want to really highlight a point that you made there, and what I would encourage listeners, especially students, you got to talk, you got to communicate, because I'm telling you that's going to make a world of difference in your clinical experience. Because I'll tell you, Again, if we think about from the CI perspective, I want to do what's best for my student. I want them to be really good. Maybe I'm newer, so I'm going to lean on what I've done before. My student's not telling me they're not feeling stressed or anything, so I'm going to assume things are going okay. So my point being is that if you don't advocate for what you're looking for in your experience, you're leaving a lot of assumption, a lot of room for assumption, right? So I really implore students, talk to your CIs day one, set up, or maybe even before your rotation, set up a call with your CI, have that conversation, get everything out on the table from day one. What is it that you're looking for in this experience? We know what your rubric and curriculum says. We know what the CPI says, but what do you want? You want to learn more manual therapy? Do you want to learn more? Do you want to get more exposure to shoulder evaluations, cervical neck evaluations, right? Get all that out on the table because that helps the CI understand, okay, now I know my student needs more shoulder evaluation experience. Let me go into the schedule. And then obviously over time, let me start with some non-complex shoulder and then start building that up into their caseload. But without that information, the CI is left to assume. And so it's like, okay, I think things are going well. So let me just, let me try this patient out. Let me try this patient out. So 1000%, you gotta, don't be afraid. Again, as CIs, we understand what day one looked like, right? We remember the way it felt. And it is hard to have that conversation, to go in and clinic on day one and say, this is what I'm looking for. This is how you can best help me. This is how I like to receive feedback. It's a little scary doing that. But I'm saying, like, if you get that out on day one, it's going to help immensely for what
Mhm.
your learning outcomes could be in that rotation. And then the other part that you said, Angela, perfect example here. If things aren't going well, you have your DCE there, right? You always have your DCE to talk to. And obviously, you know, obviously we always encourage students to work it out with your CI if there's a misunderstanding or anything. Obviously, there's a lot of professionalism that we can, display in how we handle crucial conversations and things like that. But know that you always have your DCE, right? Every organization, every
Mhm.
clinical partner is a little bit different, but your DCE is there to support you too. One thing that's different at PRN is we have a student relations managers team, which are like experienced CIs who do these. What we do is check in with all of our students to make sure that things are going okay. So again, that's one step of how we as an organization are taking clinical education to another level of saying, you know what, we're not going to wait until potential problems arise. We're going to get somebody in the clinics talking to our students, checking in with them to make sure things are going okay. No, we're not attached to the grade, so we can truly understand how is the experience going? What are we lacking and how can we grow and be better? And I'll be honest, those conversations have been hugely helpful for us in improving how we design our student program too. So again, a lot of these things your DCEs will know, but if I could recommend anything out of this talk, just advocate. Advocate for yourself, get it all out there. What do you want to learn? Let your CIs know so they know how to guide you.
And that ended it perfectly because that was my next question is like, what can a student take from this today? And I think that answers it perfectly. So I will say thank you so much for being here. It's been a pleasure. And I hope those listening, like if you have any questions about clinicals, I hope you feel a little more confident today to take that step to do what you need to do to feel more confident coming in on day one or talking to who you need to talk to get there.
Yeah.
So yeah, well, thank you so much, Patrick, for being here. It's been such a pleasure.
Oh, likewise. I appreciate the opportunity again, Angelica. What you're doing here is really special. I applaud you for what you do and the life that you lead, and I encourage you to keep doing it. This is amazing stuff, and I'm really excited for what's to come. And congratulations on
Oh,
all of your success so far too.
thank you. Thank you so much. If you enjoyed this episode, make sure to like, subscribe, and follow along for more conversations like this. Because the Rain Collective has always been about more than physical therapy. It's about the people in the profession, the stories that shape them, and the paths that remind us there's more than one way to grow. Wherever this journey finds you, I hope something here reminds you that you belong. See you next time.